Can bone marrow derived stem cells help with ankle osteoarthritis? This is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. So somebody asking, they've got ankle arthritis or ankle osteoarthritis. Could bone marrow stem cells help? Simple answer is possibly, and it depends. All right, so if you have ankle osteoarthritis, there is a chance that a regenerative medicine treatment could help. It depends on a few different things. Number one is, what's your severity of osteoarthritis? If it's moderate, mild, moderate, or a little bit advanced, it can still be very helpful. If it's more severe, it becomes harder. It may still help. It may not necessarily help as much as you want it to help, though. So part of it depends on your severity of osteoarthritis. Part of it depends on your range of motion. If you still have fairly good range of motion and you have advanced osteoarthritis, it can still be very beneficial. If your range of motion is severely limited, well, then it becomes harder to get a good benefit from your own bone marrow cells. And then it depends on what else is going on with you, right? If you have significant metabolic issues, significant neurologic issues, you may have other causes for pain as well, in which case bone marrow may not be quite as helpful. So short answer is yes, it can be helpful if you have ankle osteoarthritis. Caveat being, what is the severity? What else is going on with you to make sure you're an appropriate candidate? In all cases, make sure you get checked out by someone who's an expert. And by that, I mean they know what they're doing. They know what the data is. They know how well it can work in your case. And part of that is they have a lot of experience with that. They're going to review your imaging with you and give you realistic expectations of results. And part of it is they also know how to treat this correctly. And by that, I mean they're comprehensive in treatment. In cases where somebody gets treated for, let's say, their ankle osteoarthritis and doesn't have as good of an outcome, it may be that their physician didn't treat all the different pain generators. They may have only injected into the joint and they didn't treat the ligaments, the tendons, the bone, the nerves. They may be missing some pain generators. And then the other thing is, if they're not using the gold standard of treatments, meaning image guidance with ultrasound and x-ray, they may not even be hitting the right tissues as well. So make sure you're working with an appropriate professional with these kind of treatments to get the right kind of result.